Here we go. Question number 16. Molly Sue, she must be really old, is diagnosed with acute lymphoid leukemia and beginning chemotherapy. Her mother states to the nurse that it is hard to see Molly Sue with no hair. The best response for the nurse is what? Now, this sounds kind of like a psych question to me. So remember, with psych, it's all about what? Good therapeutic communication skills. All right. So is it A, Molly Sue looks very nice wearing a hat? You should not worry about her hair. Just be glad that she's alive. That is a crazy statement. Yes, it is upsetting, but try to cover up your feelings when you are with her, or else she may be upset. Or is it D, this is only temporary. Molly Sue will regrow new hair in 3 to 6 months, but may be different in texture. What are we thinking? And the answer is D. It is D. This is only temporary. Stacy will regrow new hair in 3 to 6 months, but may be different in texture. This is the appropriate response. Danny, come on. You got to give yourself more credit than that, my guy. The nurse should help the mother how to cope with her own feelings regarding the child's disease, so as of not to affect the child negatively, right? When the hair grows back, it is still the same color, or it is still of the same color and texture. That is psychosocial integrity. Psychosocial integrity, which is 6 to 12% on the NCLEX exam, smaller section, but still very, very much important. And I would like to do this course right before the NCLEX. Question 17, Brittany, who is undergoing chemotherapy for her throat cancer, is experiencing stomatitis. To promote oral hygiene and comfort, the nurse in charge should what? All right. Is it provide frequent mouthwash with normal saline? Apply, viscous Listerine to oral ulcers as needed? Use lemon glycerin swabs every 2 hours, or rinse mouth with hydrogen peroxide? What are we thinking? All right. So, but the answer is it's B. Apply viscous Listerine to oral ulcerations as needed. Stomatitis can cause pain. Stomatitis can cause pain, and this can be relieved by applying a topical anesthetic such as Listerine before mouth care. All right, so that is basic care and comfort, which is 6 to 12% on the NCLEX exam. Question number 18. During the administration of chemotherapy agents, Nurse Oliver observes that the IV site is red and swollen when the IV is touched. Stacy shouts in pain. The first nursing action to take is what? Do I notify the healthcare provider? Do I flush the IV with saline solution? Do I immediately discontinue the infusion, or do I apply an ice pack to the site, followed by warm compress? What are we thinking? And there it is. Hey, shout out to y'all that chose C. C is the correct answer. Immediately discontinue the infusion. Edema or swelling at the IV site is a sign that the needle has been dislodged and the solution is leaking into the tissue, causing the edema. The patient feeling pain as the nerves are irritated by pressure and the IV solution. The first action of the nurse would be to discontinue the infusion right away to prevent further edema and other complications. That's actually part of management of care, which is the largest section on the NCLEX exam at 18 to 23%. All right. Management of care. Remember, delegation, assignments, supervision, managing the care of individuals and of multiple individuals. Anyways, question number 19. The term blue bloater refers to a male client. Which of the following conditions? Is it acute respiratory distress syndrome, asthma, chronic obstructive bronchitis, or emphysema? And the answer is C. It's chronic obstructive bronchitis. Clients with chronic obstructive bronchitis appear bloated. They have large barrel chest and peripheral edema, cyanotic nail beds, and at times circummoral cyanosis. That's physiological adaptation. Third largest section on the NCLEX at 11 to 17%. All right. Question number 20. The term pink puffer. Man, are these like vape pens? Like what the fuck? I'll just play it. Refers to the female client with which of the following conditions? Is it ARDS, asthma, chronic obstructive bronchitis, or emphysema? But the answer is D, it's emphysema. Because of the large amount of energy that it takes to breathe, clients with emphysema are usually, is it cachectic? Cachectic. There it is. I remember it's cachectic. They're pink and usually breathe through pursed lips, so pursed lip breathing. Hence the term puffer, right? Physiological adaptation. Physiological, Vina, I saw you got that right. Physiological adaptation, third largest section on the NCLEX exam. Third, Julia, what's up, Miss Lady? Physiological adaptation, third largest section on the NCLEX at 11 to 17%. All right.